A Guide to Immunisations at 1 year of age. A leaflet from the NHS and Adult Health and Social Care. The Childhood Immunisation Programme. Remember to bring your red book of immunisation with you to each appointment. This leaflet features the immunisation schedule from February 2022. Summary. Which immunisation will my baby have at 1 year of age? Your baby will have 4 injections at their 1-year vaccination visit, including their Men B booster immunisation, a Hib Men C immunisation against Hib, Haemophilus influenzae type B, and meningococcal group C disease, Men C. A PCV13 booster immunisation against pneumococcal disease, caused by some types of pneumococcal bacteria, their first MMR immunisation against measles, mumps, rubella. Immunisations at 1 year of age. Protecting against Hib, meningococcal groups B and C disease, pneumococcal disease, measles, mumps, and rubella. What is Hib? Hib is an infection that can lead to a number of major illnesses, such as meningitis, inflammation of the lining of the brain, septicemia, blood poisoning, and pneumonia, especially in young children. The Hib Men C vaccine is called Menitorix. You can view the patient information leaflet here. www.medicines.org.uk/EMC/product/167/PIL. What is meningococcal disease? Meningococcal disease is a serious infection that can also cause meningitis and septicemia in children and young people. Group B meningococcal bacteria, Men B, are currently responsible for most cases of meningococcal disease in the UK, while meningococcal group C, Men C disease, is now uncommon because most young children and teenagers are routinely vaccinated against Men C. The Men B vaccine is called Bexsero. You can view the patient information leaflet here. www.medicines.org.uk/EMC/product/5168/PIL. Which vaccines will be used? Your child will have a dose of a combined Hib Men C vaccine, as well as a booster dose of a Men B vaccine. These vaccines will be given in the muscle of the thigh or upper arm. Why does my child need booster immunisations? Booster immunisations are given to increase the protection already given by the immunisations your baby has had earlier. The protection offered by the infant vaccinations can wear off after some time. A booster dose extends the period of protection into later life. Will the Hib Men C and Men B vaccines have any side effects? your child may have redness, swelling, or tenderness where they had the injection. About half the children who have the vaccine may become irritable, and some get a mild fever. You can get more information on this from your GP, practice nurse, or health visitor. What is pneumococcal disease? Pneumococcal disease is one of the most common causes of bacterial meningitis in children, but it also causes septicemia, pneumonia, ear infections, otitis media, and other serious illnesses. There are more than 90 different types of pneumococcal bacteria. Which vaccine will be used? The vaccine used is a booster dose of PCV13 pneumococcal conjugate vaccine. Which protects against 13 different pneumococcal types that most commonly cause pneumococcal disease in children. This vaccine will be given in the muscle of the thigh or upper arm at the same visit as the Hib Men C and Men B vaccines. Will the PCV vaccine have any side effects? Out of 10 babies immunised, 1 or 2 may get swelling, redness, or tenderness at the injection site or get a mild fever. The PCV vaccine is called Prevnar 13. You can view the patient information leaflet here. www.medicines.org.uk/EMC/product/453/PIL. What is measles? Measles is caused by a very infectious virus. Nearly everyone who catches it will have a high fever, a rash, and generally be unwell. The complications of measles include chest infections, fits, seizures, encephalitis, infection of the brain, and brain damage. In very serious cases, measles can kill. What is mumps? Mumps is caused by a virus, which can lead to fever, headache, and painful, swollen glands in the face, neck, and jaw. It can result in permanent deafness, viral meningitis, and encephalitis, inflammation and swelling of the brain. What is rubella? Rubella, German measles, is a disease caused by a virus. In children, it is usually mild and can go unnoticed. But rubella in pregnancy is very serious for unborn babies. It can seriously damage their sight, hearing, heart, and brain. This condition is called congenital rubella syndrome, CRS. What is MMR vaccine? It contains weakened versions of live measles, mumps, and rubella viruses. Because the viruses are weakened, people who have had the vaccine cannot infect other people. In the UK, we have 2 MMR vaccines. Both work very well. One contains porcine gelatine and the other doesn't. If you want your child to have the porcine gelatine-free vaccine, discuss it with your practice nurse or GP. How and when is the vaccine given? The vaccine is injected into the muscle of the thigh or upper arm. It is given at 1 year of age after the immunity the baby got from their mother fades. A second dose of the vaccine should be given again before your child starts school at around 3 years and 4 months of age. How effective is the MMR vaccine? MMR vaccine has been responsible for almost wiping out these 3 diseases in young children since it was introduced in the UK in 1988. Will the MMR vaccine have any side effects? The 3 different viruses in the vaccine act at different times and may produce the following side effects after the first dose. 6 to 10 days after immunisation, as the measles part of the vaccine starts to work, about 1 in 10 children may develop a fever, and some may develop a mild measles-like rash and go off their food. About 1 in every 1,000 immunised children may have a fit caused by a fever. This is called a febrile convulsion. However, children who are not immunised and get measles are 3 times more likely to have a fit. About 3 weeks after MMR vaccination, as the mumps part of the vaccine starts to work, some children may rarely get mumps-like symptoms, fever and swollen glands. Very rarely, children may get a rash of small, bruise-like spots in the 6 weeks after the vaccination. This is usually caused by the measles or rubella parts of the vaccine. If you see spots like these, take your child to the doctor to be checked. Your doctor will tell you how to deal with the rash and how to protect your child in the future. Fewer than 1 in a million children may develop encephalitis, inflammation and swelling of the brain, after the MMR vaccine. However, if a child catches measles, the chance of developing encephalitis is between 1 in 200 and 1 in 5,000. MMR is the safest way to protect your child against measles, mumps, and rubella. What if my baby is allergic to eggs? The MMR vaccine can safely be given to children who have had a severe allergy, anaphylactic reaction to egg. If you have any concerns, talk to your health visitor, practice nurse, or doctor. Does the MMR vaccine contain gelatine? In the UK, we have 2 MMR vaccines which work very well. One of them contains gelatine and the other one doesn't. If you would prefer to have the vaccine that does not contain porcine gelatine, talk to your practice nurse or GP. You can view the MMR vaccine patient information leaflets here. Priorix. www.medicines.org.uk/EMC/product/1159/PIL. MMR Vax Pro. www.medicines.org.uk/EMC/product/6307/PIL. Watch out for meningitis and septicemia. Both meningitis and septicemia are very serious. It is important that you recognise the signs and symptoms and know what to do if you see them. Early symptoms of meningitis and septicemia may be similar to a cold or flu: fever, vomiting, irritability, and restlessness. However, individuals with meningitis or septicemia can become seriously ill within hours, so it is important to know the signs and symptoms of these conditions. What is meningitis? Meningitis is an infection of the lining of the brain. Meningitis can be caused by several types of bacteria or viruses. Infection with meningococcal bacteria can cause meningitis, septicemia, blood poisoning, pericarditis, inflammation of the lining of the sac that contains the heart, and arthritis, swelling of the joints. In babies, the main symptoms of meningitis may include a high-pitched, moaning cry, irritable when picked up, a bulging fontanelle, drowsy and less responsive, being difficult to wake, floppy and listless, stiff with jerky movements, convulsions, fits, refusing feeds, vomiting, skin that is pale, blotchy or turning blue, a fever. What is septicemia? Septicemia is a very serious condition when the bloodstream is infected. The signs of cold hands and feet, pale skin, vomiting, and being very sleepy or difficult to wake can come on quickly. If you suspect septicemia, get help urgently. In babies, the main symptoms of septicemia may include rapid or unusual patterns of breathing, skin that is pale, blotchy or turning blue, fever with cold hands and feet, shivering, vomiting and refusing feeds, red or purple spots that do not fade under pressure. Do the glass test explained in the next section. Pain or irritability from muscle aches or severe limb or joint pain, floppiness, severe sleepiness. It is important to remember that not everyone will develop all the symptoms listed. If an individual develops some of the symptoms, especially red or purple spots, get medical help urgently. If you can't get in touch with your doctor or are still worried after getting advice, trust your instincts and take your child to the emergency department of your nearest hospital. The glass test. Press the side of a clear drinking glass firmly against the rash so you can see if the rash fades and loses colour under pressure. If it doesn't change colour, contact your doctor immediately. Where can I get more information? These charities provide information, advice, and support. Meningitis Research Foundation. Visit www.meningitis.org. Free helpline at 080 88 00 3344, 9 a.m. to 10 p.m. weekdays, 10 a.m. to 8 p.m. weekends and holidays. Meningitis Now. Visit www.meningitisnow.org. 24-hour helpline at 0808 80 10 388. You can also ask your doctor, practice nurse, or health visitor for advice, or contact NHS 111. Online at 111.nhs.uk, NHS 111 BSL Interpreter Service at www.nhs.uk/111, text phone at 1800 111 or call 111. Parents and carers can report suspected side effects of vaccines and medicines through the Yellow Card Scheme website, using the QR code, downloading the Yellow Card app, or by calling the phone line. Call 0800 731 6789, 9 a.m. to 5 p.m. Monday to Friday. www.nhs.uk/help mhra.gov.uk/yellow card. Immunisations schedule from February 2022. This section features the immunisation schedule from February 2022. It includes 3 tables. Table 1, the Routine Childhood Immunisation Programme, from February 2022, telling you at what age a child should have each vaccine, the vaccine given, and diseases protected against. Table 2 lists additional vaccines for individuals with underlying medical conditions, telling you for each condition the vaccine required and diseases protected against. Table 3 lists the Selective Childhood Immunisation Programme, telling you for each target group at what age or stage a vaccine is required and for what disease. Table 1, Routine Childhood Immunisation Programme from February 2022. When? 8 weeks old. When? 12 weeks old. When? 16 weeks old. When? 1 year old, on or after the child's first birthday. When? Eligible pediatric age group. See notes at end of section. When? 3 years and 16 weeks old, or soon after. When? Boys and girls aged 12 to 13 years. When? 14 years old, school year 9. Table 2. Additional vaccines for individuals with underlying medical conditions. Additional vaccines for individuals with underlying medical conditions. Medical condition, asplenia or splenic dysfunction. Including sickle cell and celiac disease. Medical condition, cochlear implants. Medical condition, chronic respiratory and heart conditions. such as severe asthma, chronic pulmonary disease, and heart failure. Medical condition: chronic neurological conditions, such as Parkinson's or motor neurone disease or learning disability. Medical condition: diabetes. Medical condition: chronic kidney disease, CKD, including hemodialysis. Medical condition: chronic liver conditions. Medical condition: hemophilia. Medical condition: immunosuppression due to disease or treatment. Medical condition: complement disorders, including those receiving complement inhibitor therapy. Table 3. Selective Childhood Immunisation Programme. Target group: babies born to hepatitis B infected mothers. Target group: infants in areas of the country with TB incidence greater than or equal to 40 in 100,000. Target group: infants with a parent or grandparent born in a high incidence country. Target group: children in a clinical risk group. Target group: pregnant women. For tuberculosis, where the annual incidence of TB is greater than or equal to 40 in 100,000, see gov.uk/tuberculosis/TB-by-country-rates-per-100,000-people. Copies of these booklets are available from your clinic or doctor's surgery. See also www.nhs.uk/vaccinations. This BSL leaflet and a standard version can be ordered or downloaded from www.healthpublications.gov.uk by calling 0300 123 102 or by text phone 0300 123 103. Lines are open 8 a.m. to 6 p.m. Monday to Friday. Crown copyright, product code 2022QG1EN BSL, June 2022. UK Health Security Agency Gateway Number 2022326. This edition first published December 2019.